Have you ever paused to consider how your daily habits might be silently influencing your prostate health? Could something as common and seemingly harmless as masturbation actually have a deeper impact on your well-being than you realize? What if this routine behavior carries more weight, especially as you age? The answer might surprise you, making it worth exploring a topic that, while crucial, often stays hidden in mainstream health conversations. Though small, the prostate plays a vital role in both reproductive and urinary function. It supports sperm health and ensures efficient urination. Understanding how your lifestyle choices, particularly sexual habits like masturbation, affect this gland is essential for making informed health decisions. In this discussion, we'll go beyond basics biology and address the misconceptions surrounding this subject. We'll examine the effects of daily masturbation, whether frequent ejaculation is beneficial or risky. What happens when you abstain for 30 days? By the end, you'll have clearer insights, practical tips, and a fresh perspective to help you make empowered choices. So the big question, is masturbation good or bad for your prostate? But before we dive in, if you find this topic valuable, feel free to like, subscribe, and share it with others who might benefit. Your support helps us grow and create more meaningful content. Drop a comment too. I'd love to hear your thoughts or answer any questions. Now, let's begin. About the size of a walnut, the prostate is small but mighty. It produces seminal fluid, which nourishes and protects sperm, playing a key role in fertility. It also surrounds the urethra, meaning its health directly affects urination. As you age, prostate issues can lead to symptoms like weak urine flow, frequent urges to urinate, and incomplete bladder emptying. Left unchecked, these can develop into serious conditions like benign prostatic hyperplasia, BPH, or even prostate cancer. That's why proactive care is critical, not just for sexual health, but for overall well-being. Research presents a nuanced picture. On one hand, regular ejaculation, through masturbation or sex, may support prostate health, particularly in older men. It acts like a flush, clearing out stagnant fluids, and potentially reducing inflammation or cancer risk. On the other hand, some studies suggest excessive masturbation in younger men might correlate with higher risks of aggressive prostate cancer, though evidence isn't definitive. Hormonal responses and individual physiology play a role, making moderation key. Regular ejaculation can be beneficial, but even good things can have unintended consequences in excess. The goal is to find a frequency that feels natural and healthy for your body. If you're unsure whether your habits might be harmful, don't guess. Consult a healthcare provider. A trusted medical professional can offer personalized advice based on your unique history and risk factors. Your prostate doesn't exist in isolation. Its health is deeply connected to your overall lifestyle, diet, exercise, stress levels, and, yes, sexual habits. Taking balanced, consistent steps to care for this small but vital gland can pay off significantly in the long run. Just as you'd care for your heart, liver, or brain, your prostate deserves mindful attention. Whether that means regular sexual activity or strategic periods of rest, the key is to stay intentional and informed in every decision. You may have heard of the 30-day abstinence challenge, a popular trend in wellness circles where men abstain from all sexual release, including masturbation and sex, for a month. Advocates claim it leads to physical, mental, and emotional resets. But does it actually benefit the prostate, or is it just another internet fad? What does science say? Currently, there's limited evidence that abstaining from ejaculation for 30 days causes measurable changes in prostate health. However, many men report non-physical benefits, such as increased energy and mental clarity, improved emotional balance, renewed motivation, and confidence. For some, this break acts like a reboot, reducing impulsivity and strengthening libido naturally afterward. Others notice no changes at all, and that's okay. The effects are deeply personal, influenced by age, hormones, and lifestyle. Think of the challenge as a self-awareness experiment, not a guaranteed health fix. It can help you observe your patterns around sexuality, reassess habits without judgment, make more intentional choices moving forward. Whether you discover benefits or confirm that regular release works best for you, the real value lies in reconnecting with your body and mind. As men pass 50, benign prostatic hyperplasia, BPH, a non-cancerous prostate enlargement, becomes a frequent concern. Though not life-threatening, BPH can cause frustrating symptoms that affect daily life and sexual well-being. Since the prostate surrounds the urethra, enlargement can squeeze this passageway, leading to weak or interrupted urine, flow frequent, urination, especially at night, difficulty stopping urination, the feeling of incomplete bladder emptying, but the impact goes beyond the bathroom. BPH can also influence sexual health, contributing to reduced libido, less intense orgasms, erectile dysfunction. The emotional toll of BPH symptoms often extends beyond physical discomfort, leading to embarrassment, strained relationships, and even feelings of lost masculinity. It's crucial to recognize these changes as common and manageable rather than personal failures. Modern medicine offers effective solutions ranging from lifestyle modifications to medical interventions. The critical first step is acknowledging symptoms early. Persistent urinary issues or sexual changes warrant professional consultation. Early detection and treatment can prevent complications while restoring both comfort and confidence. With proper management, BPH doesn't have to diminish quality of life, proving that seeking help is an act of strength rather than weakness. The relationship between ejaculation frequency and prostate health remains one of medicine's most nuanced discussions. Research suggests potential benefits for older men, where regular ejaculation may act as a cleansing mechanism, reducing cancer risks by preventing fluid stagnation. However, emerging studies indicate possible variations by age group, with some data suggesting younger men with very high frequencies might face different risk profiles. These apparent contradictions highlight how individual factors like genetics and overall health significantly influence outcomes. Rather than chasing universal rules, men should focus on maintaining patterns that feel sustainable for their bodies, while staying informed about their personal risk factors through open dialogue with healthcare providers. A holistic approach to sexual wellness reveals its profound connection to prostate health. Beyond physical release, sexual activity triggers beneficial biochemical processes, from stress-reducing endorphins to hormonal balance, that create an optimal environment for prostate function. The emotional aspects of intimacy further compound these benefits by fostering mental well-being and healthier lifestyle choices. Mechanistically, regular ejaculation helps maintain prostate fluid dynamics, potentially reducing inflammatory risks. Yet these advantages emerge most powerfully in contexts of quality and mutual satisfaction rather than compulsive frequency. The healthiest sexual patterns balance physical needs with emotional connection, adapting naturally through life's changes while remaining attentive to the body's signals. Prostate health ultimately reflects broader lifestyle choices and self-awareness. Conditions like BPH and cancer risks exist on spectrums where knowledge and prevention make tangible differences. The ejaculation frequency debate underscores that moderation and personalization trump rigid rules, with optimal patterns varying by individual circumstances. What remains universal is the value of proactive care, regular checkups, honest health conversations, and mindful attention to bodily changes. Sexual wellness forms one component of this picture, where quality intimacy supports both physical and mental health. The path to lasting prostate vitality begins with rejecting stigma embracing education, and viewing healthcare as an ongoing dialogue rather than reactive treatment. Small, consistent actions create compounding benefits, proving that prostate health isn't about perfection, but persistent, informed care. Every man deserves to approach this aspect of his well-being without shame or confusion, equipped with knowledge, and supported by medical professionals. The journey starts with recognizing that prostate health isn't just medical. It's fundamental to overall quality of life and personal identity.